Now I may ask on stage Marijana from Klinika za psihološku medicinu from Zagreb, Croatia. I hope that I somehow pronounced that correctly. And Massimo Candiani, he's an OBGYN from San Raffaele, Milano, in Italy, reporting back on workshop number 4.
Okay. Dear colleagues, after such a great presentation of Professor Visres, I can only add a few remarks. Yesterday at the workshop 4, we had a lot of great presentations and very fruitful discussions. And during the workshops, we analyzed current European strategies and programs on education on health professionals and patients. We analyze our research needs and programs, and we try to exchange best practices on current international benchmark education and research initiatives in Europe. So what we discussed about ethic educational and research programs, about how to involve pain medicine in medical school curricula, how to improve psychoeducation. We heard a lot of best practices initiatives, how to educate nurses. What about web-based programs for pain patients? How to make integrated care processes and how to create centers against pain. We had an example from Andalusia. Then the interesting experiences of the Galician school in public health for citizens. Then how to involve patients in pain guidelines. And we realized that it is really necessary to develop and implement specific curriculum on, let's say, basic or essential pain management at the undergraduate level for all healthcare providers involved, not only for physicians, but also for nurses and other healthcare providers. And of course, it's important to develop and to implement modules on pain management in other courses during undergraduate study. We believe that academic level is very important and that it is really beginning from the first year of study. Then, of course, to strengthening the knowledge and skills of the general practitioners. We believe it's very important on essential pain management and, of course, to develop European certification standards for pain management by all trained specialists. We discussed and we realized that it's very important to develop and to analyze predictive strategies to identify vulnerable individuals. It is very important. Also, how to integrate primary and secondary care and how to find a new business model to support it. We also discussed a lot about how to develop and how to implement communication skills in pain management, which one medical interview model to use, and how to develop experiential learning, more experiential learning by using video records, role-playing, fishbowl techniques, and other experiential learning techniques, simulated patients, etc. Also, we realized that maybe it will be good to develop personal health record for pain patients. We had an example on diabetes. And, of course, to promote person-centered education by using already validated models. So today there is the whole movement in the world on person-centered medicine. Not only patient, but person. That means medicine of the person, of psychological, physical, social, spiritual. Medicine for the person, for the positive aspects of health. Medicine by the person. That means that I'm also the person as physician. So the communication is important. And medicine with the person, with the shared decision-making. And, of course, to increase the understanding and to decrease the fear in the patients and in the physician by education, and as well as trying to increase the health behavior. And that participation of patients is very important in those processes. We cannot do anything without patients. And regarding research, we had discussed that it's really important to implement pain as a research agenda at the European level. Example is FP7 project. To promote translational research, very important from bench to bedside. To promote research not only on molecules but also on prevention and on public health issues. We analyzed best practice projects such as EGG, and we realized that there is need for more space to research and benchmarking, and that it will be good to make an easy and accessible list, that visibility is important of best practices in education, in research, how we can exchange our initiatives, and to know what we are doing in Europe. Thank you.
Well, thank you very much. I think we caught up on time without sacrificing quality. That's the way I would take it. Maybe as a moderator, one remark. I think we're not excellent in predicting the future. You remember that the inventor of the first car predicted that there won't be a market of more than 10 cars on the planet because there wouldn't be more skilled drivers to drive it. It's the same approach I would take on the vision to have a pain-free world. We cannot think it now. We don't think we find rational or scientific ways to predict that this will ever happen. But I would only encourage us to not stop dreaming about it, because I can only remember as kids, and I can remember my kids when they said, well, make the pain go away. I think that was something that touched my heart, and I think that can become an obsession for us, and I see so many people passionate about this. Let's continue to be passionate on this. With that, I may hand over to the chairman of this session before lunch, Professor Kress.
So thank you. Thank you. Can you hear me? Thank you. Yes, the pain-free world, I'm not so sure about whether a pain-free world is a wishful thing, because pain is one of the major reasons why we have survived as a species. And we know that those who don't feel any pain will also not have any gain. So, again, I think pain belongs to our life, and also death belongs to our life, and we have talked about the two things during the last 2 days, and these are maybe the most essential things during a human life at all, besides many other nice things. Nevertheless, we have reached now the end of this session that was intended to give you an overview of the results of the 6 workshops from yesterday. It was also intended to discuss these points, but I think because of the great enthusiasm of many of our rapporteurs, there was not so much time left for discussion, but I will promise you we will continue with this discussion in the future. We will keep in touch with you, and I hope you will also keep in touch with us, with EFIC, and give us your input, give us your feedback about this SIP meeting here in Copenhagen, and I may also remind you of the evaluation forms. That is an important point for having feedback from you about what you have considered very well done, what could be maybe improved in the future. So I think our rapporteurs were very, very active. They gave us an impression of what has been discussed. Now a lot of work has to be done, of course, by the proceedings reporter, who have to do the draft of these workshop proceedings, of these summaries of these workshops, so that they can be implemented in the symposium proceedings. I have very much enjoyed to be with you here during these 2 days. We had a lot of good discussions so far, and although we are not at the end of this meeting, you know that, I may already now say it was a very successful meeting, and I hope that we will continue after our lunch break with the last part of the presentations of the reports of the rapporteurs. And so it's just up to me now to wish you a nice lunch, and enjoyable rest of this symposium. So I will leave also during this afternoon, so that is already some kind of a farewell that I'm giving to you, and I say goodbye, and I hope we will see next year then again, but keep in mind the meeting is still going on. It's just my personal farewell that I say. Thank you.